Well, we're here with Dr. Pauling, a dentist in Gridley, California. That's up there in the Sacramento area?
Yep, a little north of Sacramento.
All right. Well, Dr. Pauling, tell me, I think you're practicing with your father, who has practiced in this area for a long time, Mr. Pauling also, right? Correct?
That's right.
Wonderful. So tell me, Dr. Pauling, you see, most patients out there, they kind of, to a certain degree, to them, a dentist is a dentist is a dentist. And to another degree, right, they try to kind of like go, I need a dentist which fits me. So if you don't mind, why don't you tell me what is the philosophy of your practice? I'm sure that to a very high degree you continue the philosophy of your father, but then again, if not, maybe there are two philosophies now going side by side, and that's sometimes a very, very good thing too. In fact, to me, it looks like a great combination to have a highly experienced doctor and yet somebody who just graduated and really has been introduced to the newest of all the newest and kind of fusion that. I like, I have found that combination to work with engineers and with just about everything. So tell me a little bit about your philosophy and maybe about how you became a dentist. Did your father hit you over the head and said you must, or what's the deal there?
Okay. My philosophy, which I think is fairly well aligns with my father's, is that, we need our teeth to live a happy life, a high quality of life, and our main thing is to, keep people healthy. Keep their teeth in good shape and help them when they have problems. Our teeth are also do more for us than just eating. They can affect the way we feel about ourselves, and so we also, can take care of aesthetic things, the problems or anything that patients want to change.
Right. And because of tooth, as you said, the teeth affect life, staying healthier. I think you mentioned that to me off screen a little bit ago, what most patients don't realize is how many areas the mouth affects. I mean, the mouth is not for nothing in this little head here, which God put lots of, important things in it. So, it affects the liver, the brain, the heart, headaches, all kinds of things. Sometimes people don't realize that. Is those the type of things when you say making sure they stay healthy, what you're talking about?
Yes, that's definitely part of it. And not only can your teeth, having problems with your teeth, it can make the rest of your body unhealthy, and your diet in general, you have to have teeth to be able to eat a balanced and healthy diet. And part of my degree is a little bit different than my father's. Mine's a DMD, which is a dental medicine degree, which is more focused on the general health of the body and how it can be our dental health is related to diabetes and all these other things. So that's kind of what a main important thing that we focus on as well.
Right. So when a person comes to your practice, whether, let's just say the person is a young 6, 7, 8-year-old child, can he be treated in your practice? Is that something you do?
Yes, we do. We are a general dentistry practice, which basically means we cover all fields of dentistry from pediatrics to geriatrics. We do everything in between.
So if a person needs implants, he can get them. If a person needs dentures, he can get them.
We can do some parts of everything, and an important part of being a good general dentist is to know your limitations, what you can and can't do, and when you do need to refer cases.
Absolutely. Absolutely. But you nevertheless do provide them. If there is not major complications, you will provide those type of things. Are you also straightening out teeth with braces and things like that? Are you doing that also, orthodontic work?
We do orthodontic work, not with traditional braces, but we do clear correct, which is similar to Invisalign treatment.
Right. All right, wonderful. Now, so basically, you do the gum. Obviously, a person has gum disease. You know how to fix that type of stuff, right?
That's right.
And a person has, DMJ, which the hinges going out of alignment there, and all kinds of problems occur, such as headaches and all stuff. You know how to fix those type of stuff.
Yeah, we can deal with like we talked about uncomplicated cases. We can take care of that. And again, we know when and where a specialist is needed. So, but we can do that. We can help with TMD issues.
Right, absolutely wonderful. Good. So, how did you become a dentist?
Well, growing up, I knew I wanted to go in the healthcare field. Obviously, my dad was an influence on me, but when I was a little more grown up and was thinking about this decision more on my own, I really liked that it was the healthcare field, but that I also still could, work with my hands, and it's a very hands-on kind of thing. That's what I really enjoy about dentistry. Another thing that was important to me is that I saw that my dad did have time to give back in the community and be involved in church and a lot of other service type of activities. So those are the main things that target me to dentistry specifically.
Wonderful, wonderful, wonderful. So it is a decision you liked. You kind of grew up with it and liked what you saw and became a natural type of things. And working with the hands, since you mentioned, is probably a very important thing. I'm sure that dentistry, whether it's making a smile good looking or whether it's making the tooth fitting so that it actually fits in the rest of the mouth so it doesn't get all wacko and out of alignment, probably it's just about as much art as it is actual technique. Am I mistaken there?
No, absolutely, and that's another thing that I liked about it. I enjoy woodworking and making beautiful things, and I think that totally applies to dentistry. I really love that part of it too.
Wonderful. Thanks a lot. So we'll be talking a lot more about some specific dental problems and how they affect a person. Okay. Very enlightening and very refreshing. Thank you very much, Dr. Pauling.
My pleasure.